for a woman to have their first gynae visit, or an ideal time for a woman to have their first gynecology visit, really, I always say the earlier the better, only because you get to understand your body and the changes that are going to come with your body as you grow. And I've started seeing patients from the age of 8 years old, before they even start their menstruation, just to actually introduce them to what is to come. So, little things about your body is going to undergo changes when you start having your periods, what's normal, what's abnormal, and so forth. So for me, really, as early as possible. Anyone who comes to a physician or a doctor, we always start with history taking, right, which is really important. And just really from history taking, you've basically got a diagnosis, or you have an idea of what the possible problem is. So it's those specific questions, such as what I mentioned with the dysmenorrhea, dyspareunia, dysuria, and dyschezia, the 4 Ds. And then you go more into how does the pain and so forth affect your quality of life. Talk to me about your period. So once you've got that history, then we go and examine. With the examination, I always say head to toe, but it really involves obviously what we call palpating. So you would examine the woman's pelvis, you do an internal exam, and you also do what we call a PR exam, but not all the time. But ideally, you should actually be doing a PVPR, so it's a vaginal exam and a rectal exam. The reason why we do that, we want to see, does the patient have rectovaginal nodules, right? And you can only feel that by actually examining the patient. And now what's really great, previously it was you need to go to theatre, you need to have a laparoscopy and so forth, but we are able to diagnose endometriosis with doing a good ultrasound, right? And you can see the features of endometriosis on ultrasound, and then you have your diagnosis. Speaking about diagnosis, then you've got obviously different types of endometriosis, which I think it's important that I mention. You can get endometriosis in your ovaries, right, where we call that endometriomas. You get deep infiltrating endometriosis, DIE, and you've also got peritoneal endometriosis. And what's also important is that endometriosis is implants, right, endometrial tissue that is implanted outside of the uterus. Why am I mentioning this? Because you can also get it in your chest. So that is, and just speaking to how do we diagnose it. So if you get someone every time they have their period, right, chest pain or coughing out blood and so forth, that's a red flag for, could this person have what we call extrapelvic endometriosis.
I would sometimes have a period for 2 weeks at a time, and then I would have a break for about 3 or 4 days, and then it would be back again. And heavy flow, like uncontrollable at times, and incredible pain. And that lasted for years. I mean, the pain would be so bad that I would lose feeling from my hips down to my knees. I would lose feeling. My legs would be numb. My lower back would be numb. Everything is just this, nothing would help. I could take the strongest painkillers, nothing would help. And then I went to a gynecologist in, I think it must have been 2017 or 2018. I went to a gynae. He did a laparoscopy on me, and he said to me that there's no issues. Can't see anything wrong. There was just a few polyps, and I was like, but it can't be that there's nothing wrong, because then why am I suffering the way I'm suffering if there's nothing wrong? And he put me on Vasan. And before, sorry, just to backtrack a bit, before seeing him, my GP had put me on some pills, like birth control pills, that were meant to help me regulate my period, but nothing worked. It was like these birth control pills were just making everything worse all the time. My period would get worse with these pills that were supposed to help me. And then the Vasan was a very big one for me. That one, like made my period spiral even more out of control. And then I said, no, I can't take this anymore. This is crazy. And then I went to see another gynecologist in 2019. She said to me that it doesn't sound right. It sounds like something's off. And she does quite a lot of work with endometriosis and PCOS. And then I went and did a laparoscopy with her. The first laparoscopy, she said there's slight signs of endometriosis, like maybe a stage 1 endometriosis, and that I probably, based on my symptoms and everything, it's more likely that I have PCOS. And then, because she could see quite a few cysts, there were quite a few cysts on my ovaries, and then we did the laparoscopy. Everything was fine for a short while. She put me on a different pill. I can't remember the name too well. And then she put me on Depo-Provera, the injections, the 3-month injections. That also just made it worse, uncontrollable. And then I went back to her again for a second consult. I think it was about a year later. I went back to her for a second consult. She said, no, let's go do another laparoscopy just to investigate and see what's going on. And after that, she then told me that I had severe endometriosis. It's about a stage 3, stage 4 endometriosis. Had like every lesions on the outside of my uterus, over my pelvic area, everything. She said that my uterine lining was so thick, it was growing into my fallopian tubes and then exiting that way and growing on the outside. And then went for the laparoscopy again. Everything was fine for probably about 6 months. And then it just starts all over again. The bad pain, everything. She suggested that I get the Mirena. I went and had the Mirena inserted and everything. Didn't help. Still periods for 2 weeks, 3 weeks long, endless pain. I eventually actually got to a point where I was having period pains every single day of my life. From when I wake up in the morning till I go to bed at night. Pain. Dead legs. My lower back would be numb, everything, just all the time. And then I went to her again, and then she said no, she thinks that the endometriosis is just growing and it's stronger than what the Mirena is able to do. And then when she did like an internal scan, she saw that my lining had actually grown around the Mirena, and even when I had my period, all the lining wasn't shedding, so it was just kept growing and growing and growing. And then it just kept getting more hectic, and then she diagnosed me with stage 4 endometriosis and adenomyosis and PCOS.
When I decided to start trying for a baby, I thought, because at school it's you're going to get pregnant or you're going to get sick or whatever. I thought, okay, it's going to be easy. So trying until I went into fertility treatment was about a year, and only then, because then I had to go in for an op, and then did the gynae tell me, oh wait, you've actually got stage 4 endometriosis. So I'm like, but what is it? I knew about it, but I didn't know there were different stages for it. So obviously started doing a lot of research on it on my own. Then went into the fertility treatment. They educated me a bit more about it, because I had no idea. I also had no idea you could do certain surgeries for it, which I had done. And only then did I learn it could cause cysts, it could cause that, because that's how I ended up.
So treatment options for endometriosis really vary, and the reason I say that, as I mentioned before, it has different manifestations. When patients come to us, most of the time it is because of pain or infertility. So we have to ask ourselves, or it's both. So treating infertility and endometriosis is different to treating pain and endometriosis. If the patient has both pain and infertility, we generally prefer to deal with the infertility aspect first, because there's a time limit on how long a woman can be fertile for. And so we look at age of the patients. So from a fertility point of view, it's not to say patients who've got endometriosis can't conceive spontaneously. Yes, they can. But once they've been diagnosed, then they're aware that they may struggle to conceive spontaneously. So with those patients, most times we do ART, so ART, assisted reproductive technology, so IVF basically. But we can also do other things, such as just doing fertility enhancing surgery and basically allowing time for them to fall pregnant spontaneously. When a woman is not ready to conceive, we can do oocyte cryopreservation, that's basically egg freezing, so that therefore we can manage the endometriosis after we have frozen the eggs. So that's really from a fertility point of view. I'm not going to go into deep detail about how we do IVF and so forth, but it's important that patients with endometriosis know that they do have options if they have pain and fertility problems, or just pain, is that they really should consider freezing their eggs before undergoing any form of radical treatment for the pain as a result of endometriosis. Then I want to come to the pain aspect of it. You can treat it medically and you can treat it surgically. And I'll tell you when we treat it surgically. So medically, it's in the form of hormonal treatment. So the big one is your progestogens that we give patients, and that is basically to suppress the endometriosis lesions. And then there will be pain medication as well that we will give the patients. And there's also what we call GnRH analogs. So I always say it's a medical menopause that we give patients, because now you're not having your period anymore, because remember, they get these period pains. If medical treatment does not work, that's when we go into surgery. And the surgery is quite radical, because it's really about clearing the pelvis of endometriosis lesions. But I must point out, this does not mean removing the womb, because remember what I said, endometriosis is outside of the womb. And then if it's both, basically it's a conversation to have with the patient in terms of, okay, you've got fertility problems, but you've also got pain. On a scale of 1 to 10, which one is more bothersome? So it's important that we actually have the conversation with the patient, and we give the patients, involve them in their treatment, and not to just make an authoritarian decision on their lives. It's extremely difficult when, I've had a patient where she had the extrapelvic and the pelvic endometriosis and did not have children. And she's just like, the pain is too much. I've suffered so much that the thought of even going through this so that I can have a child is just not worth it for me. And now that's where the emotional support, mental health support comes in. That's where you get the psychologists, because that's what happened. The pain is so overwhelming for the patients there's very few women who would say, I don't want to have kids. So to make that decision, then you must understand the intensity of this disease process.
What we've seen in practice, especially with the medical professionals that I work with, is that after the first consultation with the medical professional, usually the referral to therapy or to psychology is made immediately after that. So it's not necessarily
let's do the medical intervention first, then refer to psychology. Psychology is also used as a screening tool to kind of see a patient's readiness for treatment, possible response to treatment, and this is actually highlighting quite an integrated approach when it comes to physical and mental health. So usually the two run in conjunction with each other. You see a patient is in consultation and is mid-treatment with a medical professional, but also undergoing therapy at the same time. It actually paints a more positive prognosis because the two seem to be somewhat interlinked. There's an interrelated cycle when it comes to mental and physical health. So usually the response to the physical treatment or the medical treatment, be it pain management, is also influenced by one's mental status at the time. If you are severely depressed or anxious, the effects of the medication are not going to be as effective as we want it to be, because already the mental state has either ruled out that the medication is going to work, or the anxiety is actually causing more distress.
First baby was IUI. Luckily, first time, but a lot of medication, injections, then a lot of support injections like progesterone and that to fall pregnant with that one. And then the second one was just a miracle. After about 2 failed IUIs and 3 failed medicated cycles, I managed to get pregnant with that one. I don't know if it was my body's, because like I told you before, I was already in perimenopause. So I don't know if it was like that last bit of an egg that came out. So that one was a natural conception.
And then, you know, I just need a second. And then the whole thing came about of that, you know, I probably won't be able to have kids one day, and that my uterus is a hostile environment and everything like that. And then my mom had heard of a doctor who he's also a gynecologist. He specializes in endometriosis with fertility, or he's a fertility specialist. He specializes in endometriosis when it comes to fertility, helps women and everything like that. So we thought, you know what, let's just go see him. Even though I'm not trying to have kids, let's just go see him. Maybe he can provide more guidance. He then did a whole bunch of blood tests on me to see like my egg count, all of these blood tests and my thyroid and everything like that. And then when I went to see him, he actually told me that my thyroid has been inactive for the past 5 years, and it was something that was never detected before. So he said to me and my mom, you know, let's just try this thyroid tablet and let's see what happens. You know, maybe that will control it. And suffice to say, the 30 Rand pill changed my life. I've gone from having a period for 2 weeks at a time to one day, if it comes. It's here for like one day, and the Mirena is actually doing its job now by preventing my period from coming and from the lining growing and everything like that because of the thyroid tablet. And then my mom had heard of a doctor who he's also a gynecologist. He specializes in endometriosis with fertility, or he's a fertility specialist. He specializes in endometriosis when it comes to fertility, helps women and everything like that. So we thought, you know what, let's just go see him. Even though I'm not trying to have kids, let's just go see him. Maybe he can provide more guidance. He then did a whole bunch of blood tests on me to see like my egg count, all of these blood tests and my thyroid and everything like that. And then when I went to see him, he actually told me that my thyroid has been inactive for the past 5 years, and it was something that was never detected before. So he said to me and my mom, you know, let's just try this thyroid tablet and let's see what happens, maybe that will control it. And suffice to say, the 30 Rand pill changed my life. I've gone from having a period for 2 weeks at a time to one day, if it comes. It's here for like one day, and the Mirena is actually doing its job now by preventing my period from coming and from the lining growing and everything like that because of the thyroid tablet. It's just a tablet I take once a day in the morning. It's for 30 days, and it was it was quite quick. The turnaround was quite quick, and the effects of it were quite quick. I'd say probably within a month I started seeing results where, as previously mentioned, going from having a period for 2 weeks at a time and then having a very short break and then having it again, or sometimes even just like endlessly, it then started to progressively get better, where it was then, I would have it for a normal amount of time of 6 days, 7 days, to then going down to about 2 or 3 days. And now sometimes I don't get it at all. I'll still get a few cramps here and there, but I always say that when I get those, I always say that it's just my ovaries saying, hey, we're still here, we're still alive. So, and then, sometimes I won't get a period at all, and then other times I'll get it for a day, but very light, nothing compared to the nightmare I used to go through. And then there will be times where the cramps will be a lot worse, but then I think that that's more related to the cysts that I do still get, unfortunately. And then sometimes, even now, sometimes when I get my period, I don't even have any pain or discomfort at all, which is incredible. I've gone from having no feeling in my legs to being absolutely fine. That thyroid medication feels like a miracle worker, and I even want to go back to that doctor to just say to him, thank you so much, like you have actually changed my life. And I always say, like, I can't believe how a 30 Rand tablet has changed my life. It does make me a bit scared that, when it comes to a point of if I am able to come off the thyroid medication, what might happen? Will I go back to what I was going through, or will it be better? Will my body then learn to now cope on its own? That is a fear of mine. So I don't know. I don't really want to be on medication for the rest of my life, but if it means that I can have a better quality of life by just taking thyroid medication, then I think I'd choose that.
See, I'm grateful every day. Every day. I must say, I still wake up every morning and look at the baby and like, how? And my first is turning 5 tomorrow. So even looking at them, I don't know how we got here. I'm so grateful though. It's so heartwarming. I'm like, it still doesn't feel real though. Like, I'm not sure if other people feel the same way after going through all this, or if you feel a different way if you didn't go through this. But for me, I'm literally every morning, even if I get upset with them, I'm like, oh, but you're my miracle children. So, okay, they're still not going to get away with a lot, but, but no, it's heartwarming. There's hope out there. There's so much hope.